Most believe stem cell therapy is just about replacing dead brain cells, like patching a wall in a wall. But what if they're actually cellular paramedics, donating their own power sources to rescue dying neurons? And they also act as diplomats, calming the intense inflammation that accelerates brain diseases. This is the true story of stem cells, a multifaceted attack on disease, going far beyond simple replacement. Next, we will show how they work, their effect on specific conditions, and the future of this treatment. A primary function is creating a nurturing environment by secreting a cocktail of neurotrophic factors, fertilizer for brain cells. Factors like BDNF are support signals, telling struggling neurons to survive, grow, and form new connections. They save what's already there. Neurodegenerative conditions often have a runaway immune response. Stem cells actively reduce this neuroinflammation, calming the toxic environment. The brain also forms glial scars after injury, which block nerve regeneration. Stem cells can actually modulate this scarring, so they perform as gardeners, firefighters, and construction managers at once. They are restoring the entire brain ecosystem. This all sounds remarkable, but how does it work at a cellular level? The mechanisms are as clever as the results. One major question is, how do stem cells find the precise area of damage in the brain? You'll soon see the elegant answer. First, they directly halt programmed cell death, or apoptosis. They release molecules that cancel a neuron's self-destruct sequence. Next, they fight oxidative stress, cellular rust. MSCs restore a process called autophagy, helping cells clean out this damage. By stopping self-destruction and cleaning up rust, they preserve the existing neural network. It's easier to save a cell than build a new one. But their most stunning ability is the mitochondrial transfer. Neurons in crisis have failing power plants. MSCs can connect to them via tiny nanotubes and literally pass their own healthy, energy-producing mitochondria to the dying cell. This is a direct energy transplant that can reboot a neuron. These mechanisms aren't just theoretical. They are being applied to fight some of the most destructive neurodegenerative conditions. In multiple sclerosis, the immune system destroys myelin. Stem cells can become oligodendrocytes, the cells that produce new myelin insulation. In Alzheimer's, toxic amyloid plaques build up. Studies show MSCs can absorb and break down these plaques, acting as a biological cleanup crew. For ALS, a relentlessly progressive condition, slowing it down is the goal. Trials show stem cells can potentially slow the rate of decline. In Parkinson's, trials using iPSC-derived neurons show they can graft into the brain, produce new dopamine, and improve motor function. With such potential, a question arises: where do these cells come from? The answer is leading to more personalized therapies. Early work used embryonic stem cells, creating ethical debates. Science now has a better method: induced pluripotent stem cells, or iPSCs. Scientists take a patient's skin cell, turn back its clock to a stem cell state, and then direct it. This creates a perfect match with no rejection risk. Another potent source is umbilical cord tissue. The mesenchymal stem cells from this source are more primitive and proliferate at higher rates. This diversity of sources, from a patient's skin to an umbilical cord, gives researchers a flexible toolkit for specific diseases. Remember our question: how do stem cells know where to go? They have a natural homing ability, drawn to chemical distress signals from inflammation. They literally follow the sirens to the site of the injury. This confirms their role as active, targeted, cellular paramedics rushing to the emergency. But what if you could send the paramedics tools without the medic? That's the concept behind exosomes, tiny vesicles released by stem cells. These exosomes are loaded with therapeutic cargo and can cross the blood-brain barrier. This may offer a cell-free therapy in a less invasive way. From donating mitochondria to calming inflammation, clearing plaques to delivering healing cargo, this is a multi-front strategy against neurodegeneration. The future may be even more precise. Scientists are genetically modifying stem cells to be superproducers of certain growth factors. While progress is immense, much of this work is in clinical trials. Long-term safety and efficacy are still being rigorously studied. This therapy is rewriting our understanding of healing. It shows us that the most powerful pharmacy may lie within our cells themselves.